Welcome to Cardiac Pathology video part 3. We're going to be talking about more diseases that have to do with the cardiovascular system. And we've already talked in part 1 about the pathology of various different blood vessels. And then we started talking about in part 2 the heart, and we covered heart failure, congenital heart disease, ischemic heart disease, and hypertensive heart disease. In part 3, we're going to talk about valvular heart disease, and then cardiomyopathies, pericardial disease, and then tumors of the heart. So we're going to start off with valvular heart disease. And so you remember, as far as the heart is concerned, you have 4 valves. You have the tricuspid valve, which is in between the right atrium and the right ventricle. And then you have the mitral valve, which is on the left side between the left atrium and the left ventricle. Then you have those 2 semilunar valves. One is in the aorta, so we call it the aortic valve, and the second is in the pulmonary trunk, and we call that the pulmonary or pulmonic valve. And each of these valves, their job is to regulate blood flow through the heart, to make sure the blood flows in one direction only. We don't want the blood to be flowing backward. So causes of valvular heart disease would include rheumatic fever, endocarditis, and then there's congenital heart valve disease, which basically the baby is born with this. This is a malformation of the valve, even to the point that the valve isn't even there. And then we also have Marfan's disease, which is a disease where the connective tissue becomes very, very, very stretchy and the valve doesn't work appropriately. And then we also have lupus, which is an autoimmune disease, and this autoimmune disease attacks the various cells of the body, and this is also including the heart valves. Now we're going to talk in more detail about rheumatic fever and endocarditis as we go along. And then aging also can cause issues with the heart valves. So symptoms of valvular heart disease include shortness of breath, chest pain, fatigue, dizziness or fainting, fever, rapid weight gain, irregular heartbeat. So heart valve diseases can cause problems in any of our 4 heart valves. So it's not just in 1 or 2 of those valves. And there's 3 major types of valvular heart disease. One of the types is called regurgitation, then you have stenosis, and then you have atresia. So let's talk about regurgitation first. Regurgitation also can be called backflow, and this is where the valve doesn't close tightly. And so what happens is the blood is going to leak back into the chamber that it's coming from instead of flowing forward into the other chamber of the heart or into the artery. So for instance, let's say that you have blood in the left ventricle and you want that blood to move from the left ventricle into the aorta so that it can go out of the heart. But the mitral valve isn't working right. It's not closed tightly enough. So now when the left ventricle starts to squeeze or starts to contract during systole, that contraction is creating pressure inside the ventricle. That pressure is causing the blood to push up on the mitral valve. Well, since the valve doesn't close tightly, that allows some of the blood, instead of all going through the aorta, some of it's going to go back into the left atrium of the heart. And this is what we call regurgitation or backflow. Stenosis, this occurs if the flaps of the valve get thick or they get stiff or they can even fuse together. And so this prevents the heart valve from opening fully. So that opening that blood would have gone through is much, much smaller, so it makes it very difficult for that blood to move from one place to another. And as a result, not enough blood can flow through that valve. Some valves can have both stenosis and even backflow problems. Now, atresia is where we have a congenital malformation of the valve, and it can be any valve. And so, for instance, in this picture, you see pulmonary valve atresia. And so this is where the child is born with this, and it's a narrowing or a stenosis of the valve. And so, of course, blood flow isn't going through that valve like it should. This is showing you mitral valve stenosis. So this is the opening here of the mitral valve, and this is not appropriate. That valve should have a much larger opening and be able to flap open as blood goes through it. Prolapse is when the valves flop or bulge back into the upper chambers during a heartbeat. So this would be like, for instance, the mitral valve again being pushed back into the left atrium when the left ventricle is contracting. So you can see that here. Here's where the mitral valve should be when the ventricle contracts to push the blood up through the aorta. But in a prolapse, this is what happens. The valve actually gets pushed up into that left atrium, and little bits of blood leak through this valve because it's not closed all the way, instead of all of the blood going back in up through the aorta. So there's some prolapse with regurgitation. A heart murmur is where you have an abnormal heart sound, and this is produced when blood flows across one of the valves that is loud enough to be heard with a stethoscope. So instead of you hearing, for instance, lub-dub, you would hear the blood flowing, which would give you more kind of a whoosh, whoosh type of sound. Calcification of the aorta can cause stenosis, and this is part of the aging process. So basically what you see is that you get these little calcium nodules. Okay, so here's a normal aortic valve, okay, and now you can see these little lumps and bumps in there. This is calcium building up inside this aorta. And this can result in an increase in left ventricular pressure, because one of the things that happens with calcification of this aortic valve and then stenosis of the valve is that not as much blood can move from the left ventricle into the aorta, and so you get this increase in pressure in the left ventricle. And then, because all this blood is accumulating in the left ventricle and it can't flow out into the aorta appropriately, you get left ventricular hypertrophy. And then relative ischemia means you don't have enough blood flow then going into your entire body like you need it, and so you have this ischemia that occurs. Now, you can have angina from this, which is basically chest pain. You have congestive heart failure that can occur because with all that excess pressure on the left ventricle, the heart failure happens. And then you can also have fainting that occurs, which we refer to as syncope. Mitral valve prolapse is fairly common. About 5% of adults have this in the United States, and it's found more often in females than in males. And this is that same kind of prolapse that we talked about in the left ventricle area. The mitral valve, the leaflets are ballooning back up into the left atrium, and you have leakage of blood through that valve into the left atrium, which of course we call regurgitation. This can lead to myxomatous degeneration, which is where the collagen proteins in this valve forms abnormally. It causes thickening and enlargement of the leaflets of the valve, and can also do the same thing with the chordae tendineae. The pathogenesis, or what causes this, is unknown. Most patients are asymptomatic. It can be potentially congenital as well. It may cause headaches, fatigue, and even some chest pains in some patients. A lot of times when a child is diagnosed early with mitral valve prolapse, this can correct itself over time. And so again, you can see this here. This is the prolapse of the mitral valve. Rheumatic valvular disease is caused by rheumatic fever. Now, rheumatic fever is a disease that occurs once someone has strep throat. If that strep throat goes untreated, it can then develop into rheumatic fever. So usually what you see is you see strep throat. It typically goes into the next step, which is scarlet fever, and then from there we have rheumatic fever. We don't see this as often anymore because obviously in comparison to the good old days, we have antibiotics that we can provide to patients that cut it off at strep throat. But if it goes all the way to rheumatic fever, the valves can become scarred, and it seems to cause more of an issue with the mitral valve. And so you may have stenosis of that valve. You may also have regurgitation of the valve. So with rheumatic fever also, so the body's the immune system's trying to kill off this strep, and so it makes antibodies. And these antibodies can actually react with antigens in the heart and in the joints. Now, in the joints, we would see the person then develop what we call rheumatoid arthritis. And in the heart, this causes other problems. So within about 2 to 3 weeks after the strep throat, the patient starts feeling this migratory, what we call polyarthritis, which means that from one joint to the next, it starts to hurt. And then they can have pericardial friction rub. So the outside sac, the pericardial sac, starts to rub with each breath, usually due to excess production of fluid around the heart. It may cause arrhythmias of the heart, and then chronic disease can actually reappear decades later. And now when we have this, we see mitral stenosis, left atrial enlargement, and then you may even see thrombi that can occur because of this. There's increased risk of infective endocarditis as well. And the long-term prognosis is variable. Some people will survive with this, with issues. Other people will not survive for long. So you see in this picture, the person has strep throat. Then they're going to start to produce antibodies that are going to cross-react with the heart. And you're going to have pericarditis, which is that inflammation and friction of the pericardial sac. It can also cause Aschoff bodies, which are these little nodules that can grow on the outside of the heart. And then it can cause endocarditis, and I'll show you what these vegetations are in just a couple of slides. This is a picture of the Aschoff body here that forms the nodule on the heart muscle. So infective endocarditis is when we have some type of microbe, like strep for instance, that is going to invade the endocardium and or heart valves. So you have two types. The first is called acute endocarditis, and this is where you have this highly virulent bug that attacks the normal valves, and half of the patients are going to be dead within days to weeks because it destroys those valves. Subacute endocarditis is where you have a lower powerful or virulent bug that colonizes the valves and the endocardium of the heart, and it's a slow onset. It lasts for a longer period of time. Most people will recover from this. The symptoms are fever and flu-like symptoms. And complications can be septicemia, arrhythmias, renal failure, or even systemic emboli. So you can see here all these little nodules that are red. These are what I was talking about when I told you about the vegetation that occurs on the heart valve. And this makes it impossible for the valve to close appropriately. The valve may get hard. Then you have stenosis and you have regurgitation that can occur. And again, you can see these are the edges of the heart valve, and that valve is not going to be able to close right. And this is vegetation as well on the mitral valve. Now, another thing you see in infective endocarditis is you see these splinter-like hemorrhages in the nail bed, which is kind of interesting. We're not really sure what causes this type of hemorrhage. It could be little emboli. Nobody really knows for sure. All right, so let's talk now about cardiomyopathies. These are any disorders that affect the heart muscle, and they cause the heart to lose its ability to contract or to pump as well or as strong as it's supposed to. The heart rhythm can also be disturbed, so you may have some arrhythmias going on there too. So you get this irregular heartbeat. So there's three groups of cardiomyopathies. There's dilated congestive cardiomyopathy, hypertrophic cardiomyopathy, and restrictive cardiomyopathy. And so the first one is dilated or congested cardiomyopathy. And this is a type where the heart muscle is diseased, and this causes the heart chambers, in particular the ventricles, to thin out, to stretch, and to get bigger. It's typically going to start in the left ventricle of the heart, and so that's what we see here. Normal left ventricle, and this is the dilated cardiomyopathy, or the larger left ventricle. So that dilated cardiomyopathy makes it really hard for the heart to be able to pump that blood from the left ventricle up through the aorta and out to the systemic circulation. The causes can be certain infections, diabetes, obesity, alcohol consumption. This seems to be a really major cause of dilated cardiomyopathy. Genetic abnormalities can also cause this. The symptoms include fatigue, shortness of breath, swelling of the feet and ankles, palpitations, and chest pain. And patients may not even notice any symptoms at first, but they come on gradually. 70% of patients are going to be dead within 5 years. The next one is hypertrophic cardiomyopathy, and this is where the muscle of the left ventricle thickens so that the left ventricular space is very small and the ventricle can't fill with blood appropriately. So you can see a normal size ventricle, normal septum here, but notice the thickening of the septum, and you can see how small the space is here. So there's much less blood can fill up in that left ventricle. The cause is a mutation of a gene which controls the sarcomere proteins. And this is what causes the septum to enlarge. The symptoms are atrial fibrillation, congestive heart failure, arrhythmia, and sudden death. The treatment are drugs that would allow the ventricular muscle to relax, or you go in and you surgically cut out part of that septum to open up the ventricular space. The prognosis, only about 4% of patients die from this annually. So you can see the dilated cardiomyopathy here, and then you can see the hypertrophic cardiomyopathy here. The third type of cardiomyopathy is restrictive cardiomyopathy, and this is where the chambers of the heart become stiff over time. Now, the heart muscle is able to squeeze, it can contract, but between contraction, when we're in relaxation, when we're in diastole, that muscle, it's not able to relax. So, because it can't relax, you can't open up the ventricular space, and it's hard for the heart to fill up with enough blood. So the causes, one is idiopathic, meaning we don't really know what causes it, but secondary is some systemic diseases. One is called amyloidosis, a second is hemochromatosis, and the third is sarcoidosis. So amyloidosis is where you have these fibrous proteins that come together and they fold, okay, in a way they're not supposed to. So these proteins within the heart muscle are forming, folding, and they're not supposed to. They're folding weird, and so now this causes the protein or the muscle to stiffen. Hemochromatosis means there's too much iron in the body, and this can cause that restrictive cardiomyopathy. Sarcoidosis is a disease where you have an abnormal collection of inflammatory cells that we've talked about in the past videos, which are called granulomas, and these can form nodules in various different organs like the lungs and the lymph nodes, but also in the heart muscle. Symptoms of restrictive cardiomyopathy are shortness of breath and peripheral edema. Treatment, well, there's not a lot of treatments, and they're not very helpful, but you can try corticosteroids to bring down inflammation, diuretics to bring down swelling, antihypertensive drugs, but still 70% of patients die within 5 years. All right, so let's move on to pericardial diseases. And pericarditis is an inflammation of the pericardium or the pericardial sac that surrounds our heart. Acute pericarditis is where you have inflammation of the pericardium that comes on suddenly, and you have a sudden onset of symptoms. Chronic pericarditis is also inflammation of that pericardial sac that lasts for about 3 months or longer after the initial acute attack. So you get acute pericarditis, but it just keeps lingering and goes into chronic pericarditis. And then you have constrictive pericarditis, which is a severe form where the layers of the pericardium become inflamed, they stiffen, they eventually develop scar tissue, they get thick, and they stick together. And this can interfere with the heart beating. So you can see in an x-ray here, this is pericarditis, and you can see how swollen the pericardial sac is. And it is definitely not supposed to be that big, which is why you get rubbing of the pericardium on the ribs. So causes of pericarditis include infection, lupus, rheumatoid arthritis, scleroderma, and symptoms include sharp pain in the chest, coughing, pain in the back, neck, or left shoulder, and trouble breathing when you lie down. Pericardial effusion is where you get the accumulation of fluid in the pericardial cavity, and this could be serous fluid, which you see with congestive heart failure, or serosanguinous fluid is serous fluid that's mixed with some blood, and this is when you have like aortic dissection, and chylous fluid is when you have a lymphatic obstruction. All that fluid can accumulate in the pericardial sac. The outcome depends on how stretchy a person's pericardial sac is. So you may end up getting cardiac tamponade from all this fluid accumulating. And this is going to cause a compression on the heart. So if the fluid is compressing the heart, it's going to prevent the heart from constricting and then being able to bounce back to its larger normal size and being able to fill up with blood. So the fluid pushes down on the heart muscle and doesn't allow that normal constriction relaxation cycle. And eventually with cardiac tamponade, it can end in death. All right, so tumors of the heart, they're fairly rare, and they're most commonly going to occur because a different tumor has metastasized to the heart. So usually we see these metastases coming from lung cancer or from lymphoma. And primary heart tumors are different. Again, this is the one that's rare, but it grows directly in the heart, and this is what we call a cardiac myxoma. It's a benign tumor, and it's usually found in the left atrium of the heart. And a myxoma, because it's benign, they aren't cancerous, but they can be life-threatening, okay? So about 74% of all myxomas are forming in your left atrium, which is what you see right here. And so depending on how big this myxoma is, it can actually prevent blood from moving into the left atrium from the lungs, which means now blood can't get into the left ventricle and it can't get into the rest of the body. And of course, that's what causes the life-threatening issues. All right, thank you for listening to part 3 of cardiac pathology.